So my path to urogynecology or female pelvic medicine and reconstructive surgery really began in residency. I was drawn to OBGYN residency because I was interested in the possibility of connecting with women along their lifespan. So starting in their teenage years and continuing through menopause. And it was as a resident that I realized just how common these conditions like urinary and fecal incontinence, pelvic organ prolapse, or pelvic pain are, and how profoundly they affect a patient's quality of life. And so it was then that I realized that I wanted to connect with those patients and help them develop individualized care plans to meet their goals. So when I interviewed, it was the first transition from in-person interviews to virtual interviews. So I was really concerned about being able to connect, but my conversations on my interview day they were comfortable, they were really enjoyable, and I felt like I was really able to get a sense of the people that I was going to be working with and the feel for the culture. And so that is really what drew me to this program, knowing that I would be definitely prepared surgically and knowing that I would be able to communicate and connect with my peers and my division was definitely what I was looking for. It's been wonderful. Like I said, fellowship is very different because you're working very closely with your division or your attendings. I've worked more closely with my staff than I ever have previously. And so it's nice to be able to have those relationships with the staff and feel very supported both professionally and personally by them. It's been wonderful. I'm looking at urinary incontinence care seeking and the experiences for Black women in the city of Milwaukee. I'm partnering with the Survey of the Health of Wisconsin. And so they, in 2018, disseminated a survey. And so I'm reaching out to some of the participants who completed the survey at that time and getting more information. There is a dearth of literature about Black women's experiences, and they're historically underrepresented in large population scale research. And so I think it's important for us to amplify their voices so that we can learn about their experiences and improve and meet those unmet needs. So I will preface with I was born and raised in New York City. And so it skews my perception of most cities. But Madison it pleases me. I mean, it has surprised me. There's always something to do if you're looking for something to do. I feel like I've been more outdoorsy than I have been previously, which is nice. So I cycle quite a bit and get around on the hiking trails. I really enjoyed that. And the food scene is really nice. So I really enjoy Madison. Yeah. I'm really confident in my training experience. I have been afforded so many opportunities here, and I feel like I've been exposed to the breadth of urogynecologic practice, and I know that I will be able to medically and surgically manage all of the conditions that are well within my purview. So I feel very confident. For anyone who's looking to any fellowship training experience, I think it's really important to know what you're looking for, but then also look for a place that can support you to that end. I think here is a unique atmosphere, a unique setting where trainees are prioritized and our feedback definitely is welcomed and implemented as best as it can be. And I think that feeling appreciated and valued as a trainee has been wonderful and something that I would highly recommend for future applicants.